Hi, it's Dr. Betty Robin with the Dentistry Rising podcast. I'm really happy to say that we're surpassing all of our goals in number of podcast downloads. And that means it seems I'm on the right track as to what you need help with and what you want to know. I do talk to many of you every day since I am a dentist as well as an attorney, and I really get what your issues are. My goal is to help you get where you want to go in the best possible way and to create the practices and lives you are proud of and want. Let's talk today about the nasty little subject dentists like to ignore. I'm talking about compensation. We will talk today about what you need to pay employees for, overtime in general, and lunch and breaks. I hear all kinds of ways that dentists try to avoid paying employees properly, or try to avoid paying overtime or paying at all for certain time. Employees call me, and even though I never represent employees, I do often listen to what they have to say, and they're not stupid. What have I heard recently? Well, from a hygienist, my doctor makes me check out when I don't have a patient in the chair. He also makes me check out when I'm sharpening my instruments, setting up my room, or cleaning my trays. Is this legal? From a front desk person, my doctor makes me sit at my desk during lunch and answer the phone. I can't go get food, and I can't go out with the other employees. I don't get paid for this since the doctor says sometimes the phone doesn't even ring, so I don't deserve pay. Is this right? From another hygienist, my doctor pays me $30 per patient as an independent contractor. I don't get paid for anything else, even though I'm required to confirm my own patients, sharpen my own instruments, and clean and set up my own trays. If the patient doesn't show up, I don't get paid, but I can't leave even if I want to, like to go to Starbucks or something. Can this be legal? Okay, so why do you care, you say? You might think, I'll just take my chances. Well, the reality is the penalties are huge, and employers generally have to pay employee attorney fees as well. Also, many violations are retroactive and cover your entire staff. So it can be a very, very expensive issue if you have a problem. And yes, I've personally had a problem, so I speak from experience. Let's start by talking about compensation. So compensation is owed for all work time. I mean, this is obvious to me. But I mean all work time. Let's get real simple here. Anytime an employee is doing anything at all for you or for the practice, you owe them pay. It doesn't matter what it is. What kind of things do I mean when I say all? Let me give you some examples. 1. Your employee stops and gets your Starbucks every morning. Yep, paid time, from the time she leaves her house. It doesn't matter that you also buy her coffee. Number 2, your employee picks up the dry cleaning on her way to work. Doesn't matter whether it's the office laundry or your personal dry cleaning. It's time worked, again, from the time she leaves her house. 3rd, any employees, hygienists, dental assistants, cleaning up trays, setting up rooms, sharpening instruments. Number 4, an employee goes to pick up lunch for you or for the entire staff. Again, it doesn't matter if you're buying the lunch. Number 5, you have a staff meeting at lunch or after work or anytime actually. And be careful if that staff meeting doesn't mean the employees end up working overtime for that day or for that week, because a staff meeting is paid time worked. 6, your hygienist confirms her patients. Yes, paid time. And the list goes on. You have the idea now. Okay, next let's talk about overtime. In California, overtime is owed on all hours worked in excess of 8 hours in a workday. Although it's generally not applicable to dentists, overtime is owed also on all hours worked in excess of 40 hours a week. So, for example, if you have an employee who works only 7 hours a day, but works 6 days a week for a total of 42 hours in a week, 2 hours would be overtime, even though no one day exceeds 8 hours. The only exception to this daily overtime rule is if you filed an alternate work schedule with the state of California and you have complied with all the requirements of filings. You should also have proof of the filing and need to comply with the current law. Alternate work schedules are no longer the panacea as they used to be, and they have their own set of rules you need to follow, which we're not going to talk about in this podcast. I just think it's foolhardy to ignore these employment laws. And let me say it again, the costs for violations are huge. Third, let's talk about lunchtime requirements. All employees must be given a lunch break, an uninterrupted and uncontrolled lunch break before they exceed 5 hours of work in a day, unless 6 hours completes the workday. Lunches for normal 8-hour workdays have to be at least 30 minutes. They also can't be too long or you move into split shift laws. But some dentists aren't very busy midday, so they require that the employees take 2 or 3 hour lunches. If you're doing this, you should consult your labor law attorney because you're doing split shifts and have to comply with those special laws. You can also not require that an employee stay in the office or do any work at all during their lunch, including listen to the phone for the phone to ring. It's their time and it needs to be uninterrupted. Employees must clock in and out for their lunch because you don't have to pay for the lunchtime and there needs to be a record that you provided the lunch. That's one thing I got in trouble for. Okay, lastly, let's talk about breaks. Employees must be given 2 10-minute breaks during a regular 8-hour workday. Rest breaks are different from lunch breaks in that you do pay employees for the time and you can control the time. Most people don't have employees check in and out for breaks, but you can, and it's safer. However, many dentists do not give rest breaks. Their reasoning is that the employee can use the restroom or eat and drink anything when they want, taking into consideration the patient's schedule. This is not good enough. A rest break must be an uninterrupted 10 minutes and must be given mid-morning and mid-afternoon. That is, rest breaks can't be added to a lunch or to the beginning or end of the workday. It needs to be mid-shift in the morning and mid-shift in the afternoon. That is, it needs to be a true break. However, you can require that an employee stay in the office during his or her break because you're paying for the time. Okay, that's enough for today, and please don't shoot the messenger. If you have questions, you should consult your own attorney because I'm not playing an attorney here on a podcast, just helping you hopefully avoid expensive problems. I hope you're enjoying my new podcast, Dentistry Rising. Don't forget to subscribe on iTunes, Stitcher, and now on Spotify too, as well as most of the other podcast players. Please leave a rating and comment on iTunes. You can also follow me on Instagram and Twitter by searching Dr. Betty Robin, DrBetterobin, or our website where you can learn a little bit more about me and our guest. Thank you and happy listening.